Hello everyone, welcome to LUMP's special lecture series featuring tongue diagnosis. Session 4. Today we will tackle the spots in the tongue. Color and localization of the spots are essential for the diagnosis. Red spots can occur as sign of an infection. Red spots connote heat. Bluish spots indicate blood stagnation. Black spots indicate heat. Pale whitish spots, cold and dampness. The localization of the spots points to the referred organ. Tip of the tongue, heart and lungs. Center of the tongue, stomach, spleen. Sides of the tongue, liver and gallbladder. Root of the tongue, bladder, kidney, large intestine, small intestine. Red spots can occur as a sign of an acute infection. In this case, they are localized mainly in the front third of the tongue. Additional signs must be used to distinguish from heart fire. Let's proceed to the cases. The first tongue belongs to a 42-year-old female. Color of the tongue body negative, that means it's normal. Pale red. Tongue body is slightly swollen in the middle. If you look closely, it represents dampness or dampness in the spleen. Then look at the tongue coating. Slimy yellow coating at the middle and at the root of the tongue. Indicates phlegm heat, damp heat in the spleen, damp heat in the lower burner. Notice the vertical crack in the middle up to the area of the lungs. Stomach yin deficiency, lung yin deficiency. Red spots are found at the tip of the tongue. This denotes heart fire. The coating and swelling of the tongue body connotes dampness and phlegm. Dampness is caused by spleen yang deficiency, or dampness is necessary to compensate yin deficiency. Additional symptoms are necessary to get precise diagnosis, but both can be caused by emotional strain. Phlegm and heat had to be expelled. Another treatment principle involves tonifying the yin of the lungs, kidneys, and stomach. If dampness and phlegm are used to compensate yin deficiency, this would reduce these signs. Next, we look at the tongue of a 44-year-old male. The color of the tongue body is not visible. We notice swollen tongue body in the middle third, which represents dampness in the spleen, and the rolled over tip of the tongue, pointing to heart fire. If you look at the tongue coating, it is thick, slimy, and yellow in the middle and posterior third of the tongue. Connotes phlegm heat, dampness, heat in the spleen, dampness and heat in the lower burner. The red spots at the tip of the tongue indicates heart fire. Thick and yellow coating indicates phlegm and heat in the middle and lower burner. The phlegm and heat in this area must be dispelled. Depending on symptoms, heat in the heart must be dispelled if necessary. Tonifying the spleen yang to help transformation must be done carefully to avoid increasing the heat. Tongue number 3 belongs to a 62-year-old female. Color of the tongue body is red, indicating heat. If you look at the tongue body, it's narrow in the front third, so it means lung yin deficiency, heart yin deficiency. No tongue coating at the sides means that there is liver yin deficiency. Notice the small horizontal cracks in the middle third, stomach yin deficiency, and the red spots at the left side, liver fire. This tongue demonstrates heat and yin deficiency. Kidney yin deficiency, which has spread to the rest of the body, is the cause. Depending on symptoms, yin of the concerned organs has to be tonified. Yin of kidneys, liver, stomach, and heart has to be considered. Tongue number 4 belongs to a 36-year-old female. Color of tongue body, negative. It's normal. Tongue body is thin at the tip, indicating heart yin deficiency. The sides are swollen, and this denotes liver qi stagnation. Notice the retraction at the root of the tongue, which is very indicative of kidney yin deficiency. Tongue coating is thin and white, so it's negative. Notice the slight crack in the middle of the tongue. This is stomach yin deficiency. And also red spots on the swollen sides. This denotes liver fire. The swollen sides, indicating liver qi stagnation, attract attention. If there is an emotional cause, it is necessary to recognize it and to move the liver qi. The tendency to yin deficiency of the zangfu must be treated as well. Next is the tongue of a 55-year-old male. Color, reddened, indicating heat. Tongue body is slightly swollen, indicating spleen yang deficiency, dampness. Then notice the indentation at the tip. So the tongue body is divided and it's rolled under the tip of the tongue. Heart yin deficiency. And the depression or the retraction at the root of the tongue, this is a sign of kidney yin deficiency. Tongue coating is yellowish gray at the center, so it's phlegm heat in the stomach, and yellowish gray coating at the root of the tongue, phlegm heat in the bladder or large intestine. Reddened sides without coating, so it is a hyperactive liver yang. Also notice the red spots at the tip of the tongue, so that's heart fire. Slight vertical crack up to the tip, so hinting to yin deficiency of the stomach, lungs, and heart. The indentation at the tip of the tongue, or the divided tip of the tongue, would mean that there is disorder of the heart. The tip of the tongue is rolled under with some red spots. So this is heart yin deficiency with heart fire. Then we have reddened tongue body points, which denote heat. And the root of the tongue has a retraction. That means there is heat caused by kidney yin deficiency. So we see dampness and phlegm here. If you look at the coating and the swelling. Dampness is caused by spleen yang deficiency, or dampness was necessary to compensate the yin deficiency. Additional symptoms, therefore, are necessary to get precise diagnosis. Treatment principle: tonify the yin of the heart and the yin of the kidneys. It is possible that this can normalize the liver fire. If dampness and phlegm are really used to compensate the yin deficiency, they have to be reduced as well. If this isn't the case, then you have to expel dampness and phlegm. Thank you very much for your attention.